Hello and welcome to Benefit News. You're here with me, Marilyn Gore, and we are on the Wellness Benefit podcast. We've been talking about diabetes and the complications that come along with it. So today we have with us Dr. Riddhi. She is a neurologist, and we'll be talking naturally about the effects that diabetes has on your brain and your nervous system. Thank you for joining us, Doctor.
Thank you, Marlene.
So let's just dive straight in.
Yeah.
We've been talking to various specialists about how diabetes affects your liver and your eyes and your kidneys. Sorry, not your liver, but your kidneys. So what does high glucose have to do with my nerves?
So glucose is the mandatory for your body. I would say, like, if the glucose is not there, we will not be able to survive.
Okay.
So the whole body weight and the brain is like 2% of total body weight, and 20 to 25% of the oxygen and the glucose requirement is only for the brain. So you can now
It's basically like the engine, right? So if you want to use your body, then you need your brain. So you're saying so the glucose that comes from your food is converted into energy, basic science, right?
Yes.
So if we have too much of it, how does that affect our nerves then?
So over the period of time, what happens when the glucose is excess in your body, it accumulates in the various parts, like glucose and its products. So various pathways are there. We are not going into that details, don't worry. So the various pathways are there, and the oxidative stress is there, and the mitochondria, you must be knowing that
the powerhouse of the cell.
Powerhouse of the cell.
Yes.
So mitochondrial dysfunction.
Okay.
And the various toxic molecules.
Okay.
Deposits in the brain, vessels, nerves. So that's how over the period of time, when your glucose level is constantly high, it affects your each and every body part. Okay. But the brain is affected the worst.
So I would assume that would affect if you say affecting your brain, then increased chances of stroke?
Yeah, definitely.
Okay, so what else? I mean, how do I know that I'm looking at diabetic neuropathy here? Like, what are my initial symptoms? When should I go to a doctor? How often should I get screened?
Yeah. So each and every diabetic patient annually screen for the diabetic neuropathy.
Okay.
So diabetic neuropathy symptoms initially starts with the numbness of the
extremities, the fingers and toes.
Starts with the usually soles.
Okay.
And gradually progresses toward your hands. Usually. And they feel the numb, some tingling sensations, like walking on the cotton.
Yes.
Yeah.
Okay.
And many a times they loses balance in the evening time because that visual feedback is not there.
Okay.
So your visual feedback is not there, and your nerves are already affected. So they usually.
उठने बैठने में दिक्कत होती होगी.
So that is related to muscle.
Okay.
Or the proximal nerves. But the usually neuropathy have the distal extremities affection. So numbness, paresthesias, slippage of chappals and everything is very common with the diabetic neuropathy. So if you are having the symptoms, then you may suffer from the diabetic neuropathy, may are suffering from the diabetic neuropathy. So that's when you have to consult the diabetologist or the neurologist for the diagnosis of the diabetic neuropathy, because the little bit difference is there. We can prevent it further damage.
So reverse तो नहीं कर सकते हैं.
It's not about the reversal.
Okay, so but you can contain it.
Yes.
Okay.
It should be under control.
Okay. So how do you do that?
Many times it's reversible.
It is.
Early one.
Because a lot of the things we've been looking at when it comes to complications in diabetes are not reversible. So when you're saying, it can be controlled.
Yes.
Okay.
Yes.
And how? So what am I looking at? Lifestyle changes, I'm assuming. Control your sugar.
Yeah, the controlling of the sugar is must. It should be the proper people should do the HbA1c. HbA1c is 3 months of the sugar control. And when the patient is suffering from the diabetic neuropathy, we would advise the patient regarding to do the eye checkup for any changes in the retinopathy. Or the nephropathy. Nephropathy, we ask for the urine routine micro test or the creatinine, because in very early phase, even your creatinine is not elevated, but just your urine routine micro show the protein. So these are the very, very early involvement.
So it's all linked between your eyes and your kidneys and the nervous system.
Yes.
So if you find problems in one, you should check the rest also?
Yes, definitely.
Okay.
And because these three systems are usually go hand in hand.
Okay.
In diabetes. So that is usually the screening thing. And the another thing is lifestyle modification. You have to take the proper sleep, then the vitamins and the sugar control. Walking is must in diabetic patients, like 30 minutes a day in 5 days a week at least. If anything is not possible, do at least this.
I was also reading recently that walking also is now reducing the chances of Alzheimer's in women, especially when not related to diabetes. But I thought that was interesting. So does that have a link here as well?
Yes.
Because you said things depositing in your brain, so which is why I made that connection. So is there any link there, or am I just making connections where there aren't any?
Walking is the best exercise. It improves the circulation, it decreases your stress level and the other metabolism also. The walking is the best exercise, I would say. And as you are asking about what precautions they should take, so I will tell each and every diabetic patients that they should check your feet. Whenever they are sleeping, you check your feet. Is there any ulcer, any wound? Many a times what happens that diabetic neuropathy patients will not be able to recognize any wound or ulcer in the legs. So if you are checking at night, if you make the habit, then you will
just in case you have minor cuts and bruises.
Yeah, because healing is also very long slow process in the diabetes. So, and apply the oil, any type of oil you can use, and do the oil massage in your feet. So that is also mandatory.
That should be like an everyday thing for diabetics.
Yeah, everyday thing.
Okay. You said early warning signs were basically limited to extremities, right? Especially your feet.
In
burning, tingling, and walking. It feels like you're walking on cotton. Anything else?
Yeah. So these are related to diabetic neuropathy, and another would be CIDP. CIDP is like it's a involvement of the proximal as well as the distal limb. Okay. So they have the
proximal is around the center, right? If I remember correctly.
Around the center of your feet, center of your legs, center of your arm, everything in the center.
Okay.
So that is proximal one. So they have the here the weakness is there, the weakness in the extremities also there, and
so things like combing your hair and all gets a little harder.
Combing the hair. And many a times diabetic amyotrophy. Amyotrophy is like the patient will have the symptoms of hip, buttock pain, thigh pains, and they are not able to get up from the sitting position. They require the support.
Okay.
That may be the sign of the diabetic amyotrophy. So in that case, you need to go early because the different treatments are available. Many a times people don't come. They come when they are wheelchair bound. So it's not reversible.
So, but now, how do patients know whether to come to a neurologist or go to somebody for muscle pain? So, I know there's a link, obviously, because that's how it is. But oftentimes we don't know which specialist, and there are a lot of few specialists. So, we don't necessarily know which specialist to go to. So, is there any way so our patients can know which ones to go to, or just go to your general diabetologist and let them guide you?
Yeah, so that is the best practice. When you are going here and there, you are confused. So go to your physician, diabetologist, and they will guide you. You go to this place, or this place. Okay. So that is the best practice.
Right. You mentioned that you have deposits in your brain. So I'm assuming that this would mean a loss of cognitive function, memory will start going.
Yeah.
Or what else is there?
Whatever the studies and the routinely what we see the patients, the diabetic and the Alzheimer, Parkinson involvement is very common. So over the period of time, amyloid deposition and the other things deposit in the brain like plaques are there. So if plaques are there in the major vessel, you will have the big stroke. In the smaller vessel, you will have the minor stroke. So that is stroke part, stroke.
And if somebody, because we mentioned that you tend to lose a little feeling also when you've got diabetes, you can't feel pain as much. So does that happen that people are having smaller strokes and not realizing it? Is that possible? So even if you have like a small heart attack also, you don't necessarily know that it's happening. True. So that is also something to look forward to.
Yes. So another is like autonomic nervous system. Autonomic nervous system is like the third nervous system. First is the CNS, central nervous system. One is the peripheral, about the extremities, and the autonomic. Autonomic is related to your heart, your bladder, your bowel, and even sexual dysfunction is very common.
All of that can be caused by diabetes.
Yes. So when the patient is having the in advanced stage diabetic autonomic neuropathy, they have the heart attack. They will have the different symptoms like that. Left hand is paining, or many a times they don't have the symptoms and they have the heart attack. So these are the like asymptomatic patient. This is very common in case of the diabetes. They are not able to recognize it many a times.
So it also affects taste, right?
I mean, yeah.
So because I've seen a lot of elderly people within my family also. If you've got diabetes, then you tend to lose taste for something.
Yes.
So basically, so you're saying that the only thing to do is keep your sugar in control, walk more, and visit your doctor often.
Yeah.
But I suppose somebody has ignored all of this. Is it common for diabetic neuropathy patients to go into a coma? I mean, how does that work?
So many a times when patient is ignoring the like diabetes part, they are not taking the medicines. It's very common. So they will come with the very high glucose level. So
how high is very high?
It depends. Like
we were talking about threshold last time we were here.
Yes.
So every patient has a different threshold. So is there like a standard thing where you say, okay, this is dangerous now? Is there a common element that you can?
So usually about 350, 400. Many a times patient have a little symptoms, not much, but many a times above 400 patients come with the coma. So that is very common. Recently I had one patient with the 560 of blood sugar.
Good Lord.
She was knowing that she is diabetic, but she was ignoring she doesn't want to take the medicine for the diabetes, and she came up with the coma. And over the period of time when the sugar is controlled, now she's out of coma. It's not like that every time diabetic related symptoms are not reversible. It's reversible. And it's very common in case of the children also. In the children, they are like difficult patients. So, so they don't know the consequences. So many a times they don't take the insulin. But the parents. So parents doesn't give the insulin at the proper time or in the proper dosing. They don't go with a consultation with a diabetologist, and they come with the diabetic ketoacidosis. And many a times the first symptoms, like they come with the altered sensorium, many a times in children, they found to have the first time as a diabetic.
Okay. You mentioned dizziness also earlier. You're saying problems with balance and getting up and all that. Not to get into the specific science behind it, but can you explain how that happens?
Yeah. So dizziness and the specifically balance issues, walking issues are like in diabetes, when your peripheral nervous system, like diabetic neuropathy is there, you don't get the sensations from your feet. So you are not like when you are normal person, when you are putting the feet, you know that where is your feet, where are your feet. So what happens in diabetic patient, that sensation is not there.
So you're not able to know that this is the ground. It's like when you're putting a foot on a step and there isn't a step.
Yes,
something like that.
Yes.
Okay.
So many a times irregular surface is there, then they are not able to walk properly. And I told that slippage of chappal and slippage of footwear is very common. So that is one of the causes of the diabetic neuropathy, causing the imbalance while walking. Then the nervous system, like Parkinson. Parkinson can affect your walking. Even stroke. Stroke usually comes like sudden onset. But Parkinson, diabetic neuropathy.
I read somewhere that a stroke is basically it's called a brain attack. So
yeah, it's a brain attack.
So it comes on suddenly and it takes a long time to recover from.
Depends.
Okay.
Like which type of stroke it is there. So our mnemonic is like be fast.
Okay.
For the patient awareness. So be fast is like B stands for the balance. If you are suddenly losing the balance while sitting or standing or walking, you are not able to walk properly suddenly. Then E is for eye signs. Eye signs like you are not able to see from the one eye. Everything is black from one eye. Or you are seeing double.
Okay.
Or even the drooping of your eyelid. That is eye signs. F for facial involvement.
Okay.
So F is like facial involvement can be like your face is deviated to one side.
Like a partial paralysis almost.
Yes.
Okay.
Yes. Then the A is for arm involvement. Your arm and the legs are affected. You are not able to grip something. You are not able to walk properly. That is A. S is for speech involvement.
Okay.
The slurring of speech. Speech is not proper. Then
These sound a lot similar to what you look for when you have a stroke.
yeah. So it's a B fast mnemonic. So
you've got
F,
balance, you've got eyes, you've got face,
arm,
and
speech.
Speech.
I said one
Yeah.
like slurring of speech. Then when you are telling something, you are not able to understand anything. That is comprehension. That is also part of the speech.
Okay.
Then when you are understanding something, but you are not able to speak. So that is the speech involvement. If you are finding any of these symptoms, then immediately you have to call the ambulance. And as early as you go to the hospital,
The better.
more chances of like getting better from the stroke. So this is a be fast.
So basically, when you talk about increased chances of getting a stroke from diabetic neuropathy, are there any numbers involved here? Like, is there like a particular percentage of how many extra patients? I mean, is there a percentage of diabetic patients who get a stroke that they wouldn't get otherwise?
So I am a stroke specialist, so I would say that whenever the patient is coming from coming for the stroke in the hospital, 50 or more than 50% of the patient will have the diabetes.
Okay.
So that's why when
So do you have a lot of patients who come to you with a stroke and then discover that they have diabetes? Does that happen?
That is very common. And nowadays, because of stress, lifestyle disorders, many young patients are coming. Recently, I had one patient who is 35 only.
With a stroke?
Stroke.
And
And
the
found
patient-
to have the diabetes.
Okay, that sounds very scary. I mean, the whole podcast so far we've had, all of our specialists, you guys have regularly been scaring us.
No, it's
But
not
I
about
think
scaring.
it's actually a good thing because a lot of the time people with diabetes like, अच्छा diabetes ही तो है, medicine लेके चला लेंगे. But so I think it's important to scare people once in a while. So then we have people who go to the doctor more often. Otherwise Google तो है ही. So rather than that,
when like nowadays people do the routinely health checkup and everything.
so do you see that has that increased in recent years?
Yeah, so detection rate has been increased. Previously, there was no screening or nothing was there. People are like, few
So
people
people
were
are-
aware about this and they used to visit regularly and
But so people are getting more proactive in
yes.
with
But
their healthcare.
nowadays, like what happening, they want to go with the alternative medicine or many things and just they don't want to take the medicine. And after that, they end up with the one or another complications. So that's how when the patient diagnosed with the diabetes, first thing we counsel regarding you take the medicine and prevent those complications. So we don't scare the patients, but
I think you should once in a while.
yeah.
All right. Have you had any interesting cases recently? Like you mentioned this 35-year-old. Any other interesting cases that you'd like to share with us?
I told one patient is that like she was diabetic and not taking
560.
yeah. And many a times what happen, people take the Ayurvedic medicines. Yeah. So Ayurvedic medicines without supervision they are taking, and many a times Ayurvedic medicines contain the heavy metals. So diabetic neuropathy usually takes 10 to 15 years to develop in diabetic patients also. It's not like that you are diagnosed with the diabetes on the first day and then you will have the diabetic neuropathy on the second day. It's not like that.
So it's a long-term ignoring your problem.
Yes,
Okay.
yes. So when they take the Ayurvedic medicines or the other medicines, heavy metals are there. So that also affects your liver, kidneys and the nerves. So I would say that if you are taking the Ayurvedic medicines, take from the qualified Ayurvedic doctors. And we don't have that much of experience with the Ayurvedic medicines, but we will definitely say that whatever the allopathic experience we have, you have to take the allopathic medicines and
then उसके
try
साथ
to
जो
avoid
करना है
the-
करो ऐसा.
Ayurvedic medicines, I said that the lots of heavy metals are there. So their kidneys are gone over the period of time, their liver are gone, their nerves are gone, and we can't do much about it. The arsenic, thallium, mercury, this is very common in the Ayurvedic medicine.
And I mean, they sound like things killers would use in an old-timey mystery, murder mystery. I think. Anyway, so thank you a lot for joining us. This has been very informative.
Thank you.
If you have any questions, leave us a comment. If you like this, please share it with your friends and family. If you didn't like it, tell us why. I'm Marilyn Gore. This is Dr. Riddhi. And we'll be back next time. Thanks for joining.